You want his glasses off? Or
No, you leave it on. There you go. Actually, I'll give it to you in a second. Just stand right there.
là có chủ tịch trong mộ chân chú nữa.
All right, good morning, everyone. We are going to remove this feeding tube here in the office today. Our patient is very nice enough to let us share his story as to why he had this feeding tube placed and to watch us remove it and show you guys how it's done. But this is an elderly gentleman who suffered a stroke earlier this year. He was hospitalized. He was on a ventilator. Obviously couldn't eat for himself. So for some enteral nutrition, he had a feeding tube placed. This is a peg tube. So this was placed by the GI doctor. He has thankfully recovered enough from the stroke where he can eat by himself now. He no longer needs it. He can eat enough to keep his nutrients or his weight normal, and he's able to take his medications by mouth. So he no longer needs his feeding tube. So we're going to remove it today. He's had this in for over a couple months, so it's safe to remove it. If he had it placed more recently than that, we would wait, 4 to 6 weeks after the peg tube is placed to allow the stomach to scar up to the abdominal wall, because otherwise there's a risk of it falling away if we remove it too soon. But he's had this for several months. The stomach is now securely secured to the abdominal wall, so we're just going to remove it. He's going to have a gastrocutaneous fistula, which will heal on its own, and we'll show you that in just a second. But just so everyone can, does anyone have any questions before I proceed? Just go ahead. I'm going to hand my phone off to my assistant here. We have consent from everybody. So we have our patient laying down on the table, nice and relaxed. Everything has been removed, so there's nothing securing or attaching the tube to the skins, because sometimes there's some tape or some sutures. So obviously you don't want to rip it out without having that unsecured. So everything's ready to go. So we're just going to do some firm pressure, and it's going to pop right out, and I'll show you the bumper. So 1, 2, 3. That's it. So this is a little bumper that was underneath the skin. So this was inserted into the stomach. So here's the skin, here's the opening. So this bumper was underneath the abdominal wall inside the stomach. So you just have to do some firm pull to pull it out. And then this is the entire thing intact, so we know that it has not fallen apart. It's completely removed. And here's a gastrocutaneous fistula. This is the opening that's going to heal completely on its own. So if you had a large enough hole and can look down there, you can see the inside of the stomach. Sometimes some gastric juices come out. Nothing of concern. It'll just all heal up on its own. So all you have to do is have enough nutrition, and this heals up on its own. Just keep it covered. This hole will heal up in the next couple days for it, so there won't be any leakage if there is any. And then this will continue to heal, and he'll come back for a 2-week follow-up.